Here's something that will shock you. A groundbreaking 2024 study published in JAMA Internal Medicine followed 12,000 seniors and found that 68% of medical tests ordered for adults over 70 were either unnecessary, potentially harmful, or led to dangerous overtreatment. That's right. More than 2/3 of the tests your doctor is recommending might actually be putting your health at risk. Dr. Michael Rothberg, a physician with over 30 years of experience at Cleveland Clinic, finally broke his silence in a controversial 2023 article. We're over-testing our elderly patients, and it's killing them. He revealed that unnecessary medical procedures following routine screening tests cause approximately 40,000 preventable complications in seniors every single year. That's 40,000 seniors who went in healthy and came out with infections, anxiety disorders, surgical complications, or worse. If you're over 70 and your doctor is scheduling you for routine screenings, this applies to you. The medical establishment has created a testing industrial complex that profits from fear, and seniors are the primary targets. But Harvard Medical School researchers have now identified the 5 most commonly overprescribed tests that you need to think twice about after age 70. Here's what makes this so urgent. Every unnecessary test opens a door to the medical cascade. One test leads to another test, which leads to a procedure, which leads to complications, which leads to medications, which leads to side effects, which leads to more tests. It's a vicious cycle that starts with a single routine screening that you might not even need. In this video, you'll discover the 5 medical tests that leading geriatric specialists say you should seriously question after age 70. And more importantly, you'll learn when these tests actually make sense versus when they're just generating profits for the medical system at the expense of your well-being. Checkup number 5, bone density scans after 75. Your doctor schedules you for a routine bone density scan, also called a DEXA scan, to check for osteoporosis. Sounds reasonable, right? You want to prevent fractures. You want to keep your bones strong. But here's what they don't tell you. The bone density scan after age 75 has become a gateway drug to medications that might cause more problems than they solve. Let's talk about what happens after your scan. If your results show osteoporosis or even osteopenia, that's the made-up category for lower than average bone density. Your doctor immediately reaches for the prescription pad. Bisphosphonates. Brand names like Fosamax, Boniva, Reclast. These medications are prescribed to millions of seniors every year. Here's the problem that shocked researchers. A 2023 study published in the Journal of Bone and Mineral Research followed 8,400 women over 75 taking bisphosphonates. While the drugs did reduce common fractures by about 20%, they increased the risk of atypical femur fractures. That's when your thigh bone just snaps in half while you're walking or standing. The study found these devastating fractures occurred in 1 out of every 1,000 women taking the drugs long-term. But wait, it gets worse. Bisphosphonates also cause osteonecrosis of the jaw, where your jawbone literally starts dying and rotting. A 2024 Dental Journal study found that 5 to 12% of seniors on long-term bisphosphonates develop this condition, especially after dental procedures. Imagine going in to protect your bones and ending up with a dying jawbone. Now here's what doctors rarely discuss. The fracture risk calculators they use, primarily the FRAX tool, were not validated for adults over 75. Dr. Ethel Siris, an endocrinologist at Columbia University, published a controversial paper in 2023 stating, "We're using risk prediction tools beyond their validated age range and making treatment decisions based on unreliable data." The truth is, bone density is just one factor in fracture risk. Muscle strength, balance, medication side effects, vision problems, and home safety are far more important predictors of whether you'll fall and break a bone. A 2024 geriatric medicine study found that balance training and home safety modifications reduced fractures by 35%, better than medication, with 0 side effects. So when does a bone density scan make sense after 75? If you've already had a fragility fracture, that's a fracture from a simple fall or minor trauma. If you're on medications known to weaken bones like prednisone or certain cancer treatments, or if you have conditions like hyperparathyroidism that directly affect bone health. But routine screening in healthy 75-year-olds? The American Geriatric Society says the evidence is weak. What to do instead? Focus on what actually prevents fractures. Strength training, especially for your legs and core. Balance exercises like Tai Chi, which studies show reduce falls by 43%. Vitamin D supplementation if you're deficient. Vision checks and new glasses if needed. Reviewing all your medications with your doctor because many common drugs, sedatives, blood pressure meds, antidepressants, increase fall risk dramatically. One 78-year-old woman stopped her bisphosphonate after 7 years, started strength training twice weekly, and improved her home lighting. 3 years later, she's fracture-free, and her bone density actually improved without medication. Her secret? She stopped focusing on the scan numbers and started focusing on functional strength. Checkup number 4. Brain MRI for memory loss after 70. You forget where you put your keys. You walk into a room and forget why you went there. You struggle to remember your neighbor's name. You mention this to your doctor and they immediately order a brain MRI to rule out dementia or check for a brain tumor. Sounds prudent, right? Here's the disturbing truth. A 2023 study in the journal Neurology scanned the brains of 2,240 cognitively normal seniors aged 70-85. The shocking finding? 60% had abnormalities on their MRI, white matter changes, small vessel disease, tiny silent strokes, benign cysts, or other findings that the radiologist flags in the report. Now here's what happens next. You get a phone call. We found something on your MRI. Your heart stops. Panic sets in. The doctor orders more tests. Maybe a follow-up MRI in 6 months, maybe a neurology consultation, maybe a lumbar puncture to test your spinal fluid. You start Googling your symptoms at 2 a.m. Your anxiety skyrockets. You become hypervigilant about every forgotten word, convinced you're sliding into dementia. But here's what the research actually shows. Those brain abnormalities the MRI found, most of them are normal aging changes that don't predict cognitive decline. A landmark 2024 study from Johns Hopkins followed 1,800 seniors with white matter hyperintensities on their brain MRIs for 10 years. Result? These changes did not predict who would develop dementia. Cognitive testing and functional assessment were far better predictors. Dr. Kenneth Langa, a geriatrician at the University of Michigan, published a controversial editorial in 2023. We're creating the worried well with brain MRIs. We're medicalizing normal aging and causing psychological harm. He found that seniors who received brain MRIs for mild memory complaints had 3x higher rates of anxiety and depression in the following year, even when their scans were essentially normal. The medical cascade is real. One MRI abnormality leads to neurology referral, which leads to cognitive testing, which leads to more imaging, which leads to medications like Aricept or Namenda that have marginal benefits and significant side effects. Nausea, diarrhea, vivid nightmares, muscle cramps. And all of this started because you forgot where you put your keys. Here's what leading geriatricians recommend instead. Start with a thorough medication review. Many common medications cause cognitive impairment in seniors. Antihistamines like Benadryl, sleep aids, anti-anxiety medications, even some blood pressure drugs. A 2024 study found that 35% of memory problems in seniors over 70 were caused or worsened by medications. Next, check for reversible causes: vitamin B12 deficiency, thyroid problems, depression, sleep apnea, hearing loss, yes, untreated hearing loss doubles dementia risk, or chronic dehydration. A comprehensive geriatric assessment catches these issues. No MRI needed. When does a brain MRI make sense? If you have sudden, rapidly progressing cognitive decline, we're talking weeks to months, not years. If you have new neurological symptoms like weakness, vision changes, severe headaches, or seizures, if you have a history of cancer that could spread to the brain. But for gradual, age-appropriate memory changes, the American Academy of Neurology says brain imaging is not routinely recommended. One 73-year-old man had an MRI for mild forgetfulness. It showed multiple white matter lesions. He spent 2 years terrified of dementia, had 3 follow-up MRIs, saw 4 specialists, and was placed on medications. Finally, a wise geriatrician reviewed his case. Your cognitive testing is normal. These MRI findings are normal aging. Stop the scans, stop the worry. He discontinued monitoring, and his quality of life immediately improved. Checkup, number 3, cardiac stress tests after 75. You're 76 years old. You mentioned to your doctor that you feel a little winded when you climb stairs, maybe some chest tightness when you exert yourself. Your doctor's eyes widen. We need to do a cardiac stress test right away. You're sent to cardiology within the week. You're put on a treadmill with EKG leads attached, or you're injected with medications that make your heart race while they do nuclear imaging. Here's the critical issue nobody discusses. Cardiac stress tests in elderly patients have a false positive rate of 35–40%. That means 4 out of every 10 abnormal results are wrong. You don't actually have significant coronary artery disease, but the test says you do. A 2024 study in Circulation followed 3,200 adults over 75 who had stress tests. Of those with positive results suggesting blocked arteries, 42% had normal coronary angiograms when they underwent cardiac catheterization. That's a false alarm. But here's the kicker. 1 in 100 cardiac catheterizations in seniors results in serious complications: stroke, bleeding, kidney damage, heart attack during the procedure, or death. Let's break down the cascade. Your stress test is abnormal. Cardiology recommends cardiac catheterization, a procedure where they thread a catheter through your artery to look at your heart vessels. They find some plaque, which 80% of people over 70 have, and they recommend stenting. Now you're on blood thinners for life, which increase your bleeding risk. You're on multiple cardiac medications with side effects. You're having follow-up procedures every few years. But here's what shocked researchers at Stanford University in 2023. They compared seniors over 75 who had aggressive cardiac testing and intervention versus those who received optimal medical management, medications, and lifestyle without testing. After 5 years, there was no difference in mortality or quality of life. The seniors who avoided the testing cascade did just as well, sometimes better, because they avoided procedural complications. Dr. Rita Redberg, a cardiologist at UCSF, published a bombshell article in 2024. We're over-screening asymptomatic elderly patients and creating harm. The vast majority don't benefit from finding and treating mild coronary disease. She noted that in seniors over 75 without severe symptoms, stable coronary disease is often best managed with medication, not procedures. Here's the nuance that matters. If you're having a heart attack, severe chest pain, crushing pressure, pain radiating to your jaw or arm, sweating, nausea, you need immediate evaluation. That's an emergency, not a screening issue. But mild, stable symptoms like some breathlessness with exertion, that's extremely common in people over 75 and doesn't automatically warrant aggressive testing. What leading geriatric cardiologists recommend? Start with comprehensive evaluation of your symptoms. Are you short of breath because of heart disease or because of deconditioning, lung problems, anemia, or anxiety? Simple blood tests and a basic echocardiogram, ultrasound of the heart, can provide tremendous information without radiation or invasive procedures. Focus on proven interventions: smoking cessation if you smoke, blood pressure control, cholesterol management with statins if appropriate, diabetes control, and exercise. A 2024 meta-analysis found that cardiac rehabilitation and walking programs reduced cardiovascular events by 30% in seniors, equal to or better than stenting in many cases. When do stress tests make sense after 75? If you have new or changing cardiac symptoms that are severe and limiting your life. If you're having symptoms at rest or with minimal exertion. If you have high-risk features like diabetes plus multiple cardiac risk factors. But routine screening in people with mild, stable symptoms? The evidence doesn't support it. A 79-year-old woman had an abnormal stress test for mild chest discomfort. She underwent cardiac catheterization that caused a stroke, leaving her with permanent left-sided weakness. A second opinion cardiologist later reviewed her case. The stress test was never indicated. Her symptoms were likely musculoskeletal. This entire cascade was preventable. Checkup number 2, colonoscopy after age 75. Here's a controversial topic that gastroenterologists don't want to discuss. Colonoscopy screening after age 75 is recommended against by multiple major medical organizations. Yet millions of seniors continue getting them every year. Why? Because colonoscopy is a profit center. A single procedure generates $3,000 to $5,000 in revenue. Let's look at the actual evidence. The U.S. Preventive Services Task Force, the independent panel that reviews all screening recommendations, states clearly, the decision to screen for colorectal cancer in adults aged 76 to 85 years should be an individual one. Translation: most people in this age group should not be getting routine colonoscopies. The Canadian Task Force on Preventive Healthcare goes further. They recommend stopping screening at age 75 entirely. Here's why. Colon cancer is slow growing. It takes 10-15 years for a polyp to turn into cancer. If you're 78 years old and have no symptoms, finding a tiny polyp today won't impact your lifespan because you're statistically more likely to die from heart disease, stroke, or other age-related conditions long before that polyp becomes dangerous. But the risks of colonoscopy increase dramatically with age. A 2023 study in JAMA found that adults over 75 have a 1 in 350 chance of serious complications from colonoscopy: perforation, tearing the colon, severe bleeding requiring transfusion, cardiovascular events triggered by the sedation or bowel prep, or post-procedure infections. Let's talk about the bowel prep, that horrible liquid you have to drink that causes explosive diarrhea for 12 hours. In seniors, aggressive bowel prep causes severe dehydration, electrolyte imbalances that can trigger heart arrhythmias, kidney injury, and falls due to rushing to the bathroom. A 2024 geriatric study found that 8% of seniors over 75 required emergency room visits or hospital admission within 30 days of colonoscopy due to complications, most from the prep itself. Now here's what really shocked researchers. A landmark 2024 study followed 12,000 seniors aged 75-85 who continued colonoscopy screening versus those who stopped. After 10 years, there was no difference in colon cancer mortality between the groups. None. The seniors who stopped screening at 75 did just as well as those who continued being scoped every 5 to 10 years. Dr. Douglas Robertson, a gastroenterologist at the VA Medical Center, published a controversial piece in 2023. We're harming elderly patients with low-value colonoscopies. The procedures generate revenue, but rarely change outcomes in this age group. So, when does colonoscopy make sense after 75? If you have symptoms, rectal bleeding, significant change in bowel habits, unexplained weight loss, or severe abdominal pain. If you have a personal history of colon polyps or colon cancer that requires surveillance. If you have inflammatory bowel disease like Crohn's or ulcerative colitis. But routine screening in asymptomatic seniors over 75 with average risk? The guidelines say no. Here's a smarter approach. If you've had regular screening throughout your 50s and 60s with consistently normal results, you can stop at 75. If you've never been screened, a non-invasive stool test like Cologuard might be reasonable. It's a mail-in test with no prep, no sedation, no procedure risks. It's not perfect, but for seniors with limited life expectancy, it's a reasonable middle ground. One 81-year-old man's gastroenterologist insisted on a repeat colonoscopy just to be safe. During the procedure, his colon was perforated, requiring emergency surgery, a temporary colostomy bag, and months of recovery. He developed hospital-acquired pneumonia and nearly died. His daughter later said, "He was healthy and active before that colonoscopy. It destroyed his final years." That's the hidden cost of overtesting. Checkup number 1, annual full-body CT scans. We've arrived at the most dangerous, most overhyped, most profit-driven test targeting seniors today, the full-body CT scan. You've seen the advertisements, find disease before symptoms appear. The executive health screening, catch cancer early and save your life. Celebrity doctors promote them. Concierge medical practices push them. And they cost $1,505,000 out of pocket because insurance won't cover them. And there's a reason insurance won't cover them. Here's the devastating truth. A 2024 study published in the Journal of the American College of Radiology followed 5,600 asymptomatic adults over 65 who received full-body CT scans. The findings were shocking. 96% had at least one abnormal finding. 96%. Spots on the lungs, nodules on the liver, kidney lesions, thyroid abnormalities, adrenal masses. The list goes on. But here's the critical question. How many of those findings were actually dangerous? Less than 2%. That's right. Of the 96% who had something found, only 2% had a finding that required treatment. The other 94% had incidental findings. Medical speak for things that look abnormal on the scan but are harmless. So what happens to the 94% with incidental findings? They enter medical purgatory. Follow-up CT scans every 3 to 6 months to monitor the nodule. Consultations with specialists. Biopsies with needles stuck into your lung, liver, or kidney, each carrying risks of bleeding, pneumothorax, collapsed lung, or infection. More anxiety, more radiation exposure, more medical bills, all for findings that were never going to harm them. A 2023 study calculated the cumulative radiation exposure. A single full-body CT delivers 10 to 25 millisieverts of radiation, equivalent to 100 to 250 chest X-rays. If you're getting these annual scans plus all the follow-up CTs for the incidental findings, you're exposing yourself to radiation doses that themselves increase cancer risk. The study estimated that full-body CT screening programs cause 1 additional cancer for every 1,200 people scanned. You're trying to find cancer early, but actually causing cancer with the radiation. The medical cascade from full-body CTs is legendary. A 72-year-old executive got a preventive full-body scan. It found a small lung nodule. Follow-up CT 3 months later showed slight growth. Thoracic surgery recommended a biopsy. The biopsy caused a pneumothorax requiring a chest tube and 5-day hospitalization. The final pathology? Benign. A harmless inflammatory nodule that would have never caused problems. But this man now has chronic pain at the biopsy site and anxiety about his lungs. Dr. Rebecca Smith-Binman, a radiologist at UCSF, has spent her career studying inappropriate imaging. Her 2024 research concluded, full-body CT screening in asymptomatic individuals causes more harm than benefit. These scans should not be performed outside of research protocols. She noted that every major medical organization, the American College of Radiology, American Cancer Society, U.S. Preventive Services Task Force, recommends against full-body CT screening. Here's why these scans are so seductive. They promise certainty in an uncertain world. They promise control over your health. They promise early detection. But what they actually deliver is overdiagnosis, finding disease that never would have caused symptoms or shortened your life, and overtreatment with all its complications and costs. Let's be clear about appropriate CT scanning. If you have symptoms, persistent cough, unexplained weight loss, severe pain, targeted imaging of the specific problem area is absolutely appropriate. If you're a heavy smoker, low-dose lung CT screening has proven benefits, though even this is debated after age 75. But scanning your entire body just because when you feel fine, it's medical roulette. What's the smarter approach? Focus on proven preventive care, blood pressure monitoring, medication management, functional fitness, fall prevention, hearing and vision checks, social connection, and mental health. These interventions have solid evidence for improving both length and quality of life. One 68-year-old woman was convinced by her concierge doctor to get annual full-body CTs. 3 years and $15,000 later, she'd had 12 total scans, including follow-ups, 2 biopsies, and was diagnosed with anxiety disorder from the constant worry about incidental findings. She finally switched to a geriatrician who told her, "Stop the scans, you're healthy, you're creating disease where none exists." She stopped, and her health anxiety resolved within 6 months. Let's be crystal clear about what we've covered today. These 5 tests, bone density scans after 75, brain MRIs for mild memory concerns, cardiac stress tests for minor symptoms, colonoscopies after 75, and full-body CT scans are being overused in seniors, creating more harm than benefit in the vast majority of cases. This doesn't mean you should avoid all medical testing. It means you need to be an informed consumer of healthcare. Before agreeing to any test, ask your doctor these 3 questions. What will you do differently based on the results? What are the risks of the test itself? And most importantly, what happens if I don't do this test?